ask Commissioner London to lead us in the Pledge of Allegiance, and I believe Mr. Foy is going to get our flag up for us. So we're all stand for that, and Commissioner London, it's yours when ready.
Place your right hands over your heart and recite the pledge. I pledge allegiance
To the flag of the United States of America
and to the
the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. All right. So we need to start with an official roll call here tonight. Mr. Vice Chairman?
Present.
Commissioner Foy? I believe we're still waiting on his ability to connect. So we're Commissioner Jones?
Here.
Commissioner Speed?
Here.
Commissioner Pierce?
I'm here. Sorry.
Very good. Commissioner London?
here.
Very well. So right now we have 6 of our 7 board members with the communication that Commissioner Foy is attempting to join us in this virtual meeting. All right, moving on to item number 1 is the consent agenda. What is the pleasure of the board tonight?
Second.
I have a moval for approval by Commissioner Jones and a second by Vice Chairman Bunn. Any further discussion? Hearing none, we will do a roll call vote. Mr. Vice Chairman? Commissioner Foy? Commissioner Jones?
Yes.
Commissioner Speed?
Yes.
Commissioner Pierce?
Aye.
Commissioner London?
Yes.
That's 6 yeses and an absent vote from Mr. Foy. Thank you for that. So moving on to our second agenda item tonight, our comments from the public. This is a
Mr.
time set
Chairman.
aside.
Mr. Chairman, if I could stop you, if you
Yes.
will ask the board to consider the addendum for the agenda for item 5, the COVID-19 leave.
Very good. Yes, let me get to that for you real quick here.
Okay.
So let's do that now. So ladies and gentlemen, tonight we have an addendum that we'd like to make number 5 on our agenda, which is the Franklin County 2021 COVID-19 leave. This is the board is being asked to extend a provision for employee paid sick leave made available due to the coronavirus COVID-19 related reasons, and to identify the benefit as the Franklin County 2021 COVID-19 leave. So we're asking tonight to be able to add that to the agenda as number 5.
Move to add.
All right.
Second.
All right, we have a move to add by Commissioner Pierce with a second by Commissioner Bunn. Any further discussion? All right, we'll go to a roll call vote for that then. Mr. Vice Chairman?
Yes.
Commissioner Foy? Commissioner Jones?
Yes.
Commissioner Speed?
Yes.
Commissioner Pierce?
Yes.
And Commissioner London?
Yes.
All right, and I vote yes, so that is unanimous and is so ordered tonight. All right, so now we're moved back to item number 2 on our agenda, which is comments from the public. This is a time that's set aside by the Board of County Commissioners to allow individuals 5 minutes to address the board on issues concerning the county. I believe tonight we have 5, possibly 6 people signed up. Do we have Miss Carol on the line? Carol Boos?
I don't see her on there yet.
All right, what about Susan Decker?
Cannot see her either.
All right. Third one on my list tonight is Carla Rostish.
She's available.
I'm here.
All right. Good evening.
Hi there.
So we
So,
would like to get you to state your name and address for the benefit of our clerk tonight, and then we yield 5 minutes to you to share with us tonight.
Okay, sure. Okay, my name is Carla Rossage. I live at 7621 Kensington Manor Lane in Wake Forest.
All right, thank you.
All right, awesome. Okay, first of all, I'd like to say congratulations to Chairman Shriver and all the newly elected commissioners. Leading your community as public servants is not for the faint of heart, so thank you all for stepping up to the plate. I am appreciative of you allowing me to speak for a few minutes. I may not be a county constituent, at least not yet. I'm working on that. But I have nonetheless consistently served your community through my volunteer work with Paws for Life. In 2019, we alone pulled 50% of the shelter's rescued dogs. As the dog intake coordinator, I was the actual rescue person in the shelter and pulling the dogs. I haven't done my Franklin County shelter pull numbers for 2020 yet, but I do know my overall intake went from 177 dogs in 2019 to 248 in 2020. So that's probably going to translate. And I also know we are still one of the few rescues that consistently pull from your shelter. Commissioners, I have missed you. Pre-COVID, I regularly came to the meetings as an advocate for improvements at the shelter and with animal welfare in general. I think we made a lot of great strides, such as getting two new manpower positions added, a fresh approach to the shelter volunteer program, and allowing the rescues to the same opportunities as the public to get animals out of the shelter. I hope we can continue to work together for more or continued improvements. At the very top of my list this year is the lack of spay and neuter of animals, in particular dogs, when they are adopted from the shelter. I mentioned this to the sheriff at the last meeting before COVID shut things down. I can't remember exactly what he said the challenges were, but I do know my takeaway was that the challenge lies with the county's approach to money management. So this is why I'm bringing it to you. As some background, when an adult animal is adopted from the shelter, there is no spay or neuter deposit taken. You do sign an agreement saying that within 30 days of adoption, you must show proof it was altered. I know this because I have personally adopted from the shelter, and yes, my dogs were all altered. But as a rescue, I have also taken in dogs from the community that were adopted from the shelter months earlier, but were not altered when I took them into my program. One young female lab was adopted as a 2-month-old puppy in mid-2019 and surrendered to me in March of 2020, not fixed. Another male dog was adopted from the shelter in early 2020, and a month later, that person was on community pages looking to rehome the dog. I reached out to let them know we would take the dog. He was not fixed. In August, I took in an owner surrender of a beagle that was adopted from the shelter in February, again, not fixed. As I drove to the owner's house to get him to sign the owner surrender paperwork for the beagle, he had a new dog fresh from the shelter tied to his porch. Was there a 30-day follow-up when the beagle was adopted? Why was he allowed to adopt if the previous dog wasn't altered? And these are just a few examples of how many times has this happened? How can we work to fix it? And it really does need to be fixed because we have an abundance of homeless animals or animals that end up in the shelter because of not spaying and neutering. But next on my list, I'm trying to rush through this and not take up too much time. Next on my list is the Animal Advisory Board. I think it will allow the best opportunity for you, the shelter, the rescues, and the community members to all work together collaboratively to improve animal welfare, both in the shelter and out. This is something we consistently asked for with the last seated board, but didn't gain any traction. And there's so many issues that we could talk about underneath an advisory board. It includes things like reviewing the county's tethering laws and the overall the animal welfare ordinance that talks about what's humane treatment of an animal. There's so many examples out in your community of animals that are barely living in humane conditions, like tied on short leashes and no cover from the elements. And what can we do to fix that and improve that? And so these are just a few of the improvements that I think that we could work on, and I'd like to see us work on them together. I don't have all the answers, and I think we all need to come as a team. That's really all I have this time around. Thank you for your time and your attention.
Absolutely. Thank you, ma'am. Thank you for your comments tonight. All right, Mr. Floyd, do we have Ms. Decker available?
No.
All right. What about Miss Carol Boos?
No, sir, I do not see her.
All right, then we're going to Lindsay Hesh.
Okay.
Can you hear me?
Yes, I can hear you. Good evening.
Good evening. Hi, my name is Lindsay Hesh. I reside at 210 Choctaw Drive in Lewisburg. First, congratulations to the new commissioners who have been elected and to those of you who were re-elected, as well as to you, Chairman Shriver and Vice Chairman. fun for your position to be leaders among leaders. I want to thank you all for your service to this community and for finding ways to allow public comment to continue during these unprecedented times of COVID-19. As the pandemic has continued much longer than I think many of us anticipated nearly a year ago, I firmly believe that it is so important that we find ways to not only survive as a community and perform basic functions, but to continue to adapt and thrive as well. I'm coming to you today to do just that, to find ways to make us thrive as a community. And I believe it to be a very simple ask, to form an animal advisory board for Franklin County. And it has been a year since many Franklin County animal advocates, residents here, came to you with this very simple request. Having such a board is not unheard of, and in fact, our county previously had one, and nobody has been able to explain why it was dissolved. As someone else pointed out before, last year, there are currently 34 boards or commissions in place for our county. 34. They range in topics such as agricultural, planning, crime prevention, public utilities, and social services. These are all very important topics and reflective of our community values. But I cannot understand, though, with 34 boards or commissions, why not have any of them focus on both the welfare and control of Franklin County animals? Clearly, there would not be so many if they themselves were not effective. So the absence suggests that we as a community do not think this is an important enough of a topic to address. I ask you as elected representatives that many members of your community have come here to ask you to form an animal advisory board in the past, that you listen to those that have elected you. I watched in frustration last year as Foreman Chairman Dunstan both ignored, dismissed, and even gaslighted the concerns of his own constituents. I hope that a year later, we can reconvene with a more proactive and responsive Board of Commissioners. At a minimum, I ask that you perform a vote on this board's formation and any discussion surrounding it in open session. Your constituents deserve to know where you stand individually and whatever impediments are in the way to making our community what we want it to be. There are many issues that can be improved on in our community. Spay and neuter requirements, our cruelty to animals ordinance, public education and outreach, and the volunteer program at the shelter. None of these things have easy answers. And so the formation of a board to both problem solve and engage with the various stakeholders is a common sense first step. You have volunteers who want to help, but we can't get anywhere unless you give us a venue to do that in. I'm going to close with a brief anecdote for your consideration. My husband and I moved to North Carolina, to Franklin County in 2017, and being first-time homeowners and extreme animal lovers, we were ecstatic to be able to expand our fur family beyond two-pet household, not having to worry about rental requirements anymore. So in that year, we went online and found a kitten to adopt in March, and later in October, we adopted our first dog, Duchess, who definitely is royalty, as her name suggests. In both cases, we chose to rescue from a nonprofit instead of going directly to the local shelter. There are several reasons for doing this, but mostly because you can find out more about the animal's personality from foster homes. We rescued each from 2 separate, unrelated rescues, and coincidentally or not, both of these animals came from Granville County. Now, as a new resident, I thought, wow, Granville County must have a real overpopulation problem. Why is it that I, as a Franklin County resident, am randomly just ending up with these animals from Granville County? But the longer I've lived here, the more I have volunteered and fostered and got to know our community, I have unfortunately learned that it was just that they did a better job of getting them out. Based on data from 2019, the combined cat-dog euthanasia rate in Granville County was just 13%. And in Franklin, it was 32%. For cats in Franklin County, those that I foster, 52% of them were euthanized in 2019. These numbers could be much worse, but they could also be better. And my story is not to criticize our animal control. It is just to point out that there is room for improvement here. But just like all things in life, nothing fixes itself. It takes us to do it together. So please, I am asking you to make the right decision and help us. Help us form an advisory board so that we can start working on problems collaboratively. Thank you for your time and consideration.
Thank you, Lindsay. Thank you for your comments tonight. All right, Mr. Floyd, do we have either Ms. Decker or Ms. Boos online at this moment?
No, sir.
All right, then we'll move on to, is Scott Strickland available? Welcome, Mr. Strickland. How are you tonight?
Fine. I hope all y'all had a great Christmas.
Thank you. So if you would just go ahead and state your name and your address for benefit of our clerk, and I'll yield 5 minutes to you for comments.
Scott Strickland, 40 Shields Lane, Lewisburg, North Carolina, 27549.
Thank you.
And as the previous lady just said, I think advisory board over there, it worked well when we had it before. And you see what kind of mess we had when we done away with the advisory board over at the EMS building. And so I think that lady has a valid thing there to put one back in place. As I was listening to her, I mean, it just, these boards work if they will allow them to work. But moving right along with what I had talked about, I got a question for Dr. Levine. Scott Levine, when he comes up, that y'all can ask. A couple people called over to the health department to find out where free clinics were, and they were directed to a voicemail, and then they called back and they were hung up on. And you know, we got to help these folks if we want to get this virus under control. If they, you know, people need to be tested, they need to know where to go. And, you know, I just think that's very, if that happened, that needs to be fixed over there. And then the second thing I got is, you know, we've been dealing with this for years. I begged y'all last year to let's fix this radio system. And it's getting worse. You talk to the people, it's still getting worse. And our people at risk. And, you know, if we can't get something done, then we, the people, are going to have to step in and come up with some stuff. And it's going to be at the county's expense. And, you know, y'all need to do something. These people at risk, they can't talk back and forth. If they do, it's garbled and you don't understand. The telephone service don't work all over the county. And we need to get this thing fixed. We can't depend on the CAD system because the telephone system don't work. They don't have internet on the truck, so they can't send messages by the computer. And this is an ongoing problem. It's been going on too long, for 12 years. And we tried everything that Harris wanted to do, and now it's not working. Now I understand that they want to do something else. We need to just go ahead and go Viper, like everybody else across the board has done, and it works great. They done been all over this county using it. The Viper system works here. The man that runs it has been all over this county. Then the next thing I need to know is where we stand with this county broadband. You know, I've been on the list ever since I know that was a list, and ain't nobody contacted me yet. And that, I find that I was gonna put it at the Lions Club down there, and let some of the youngins use it, and we, you know, take care of the bill. Well, I can't get the man to call me back. I'm happy with that. I mean, we spent a lot of money. The county has put a lot of money into this, and for it to be everywhere but where people was asking, yeah, I know some people has got it and it works great, but I can't get him to call me back. So, you know, we need to see where that is. I mean, I'm trying to help out at my expense with the Lions Club, and if I can't get him to call him back, I can't get the service in there. And so I think that's something we need to look at. The radio and the internet is two main things that we need right now because the school kids are suffering over not having internet. I mean, I've got some over here next to the house that I've bought stuff to make sure that they had it where they could do the work. So, I mean, I think we all need to jump on this thing and help these kids out because this COVID is not going away no time soon. My mom just got out of the hospital 33 days. I mean, she went, I understand all about the COVID now. And, I think we need to do everything we can to help these school kids. And I hope y'all have a great night.
Thank you, Mr. Strickland. Mr. Foy, do we have Mr. Frank Winstead on the line? Mr. Winstead, can you hear me? Mr. Winstead, can you hear me? Hey, good evening, sir. Will you state your name and address for the clerk?
Yes, this is, sorry, Frank Winstead, 145 Victoria Court, Youngsville, North Carolina, 27596-7739-45. Happy New Year. Celebrate the new year by looking at why the county does things a certain way. Let's start with your own consent agenda. For the now ousted, deposed party, placing the consent agenda before public comments was an easy way to spend a lot of money with limited public oversight. Now that the respected party controls the Board of Commissioners, it would be a good time to have public comments before the consent agenda. This would give concerned citizens a better opportunity to participate before approvals of such things as spending $2 million to renovate an abandoned Walmart into a Taj Mahal for undisclosed county government elite. The Taj will be little more than an exclusive country club. And speaking of spending, something on your agenda but not on the consent agenda is acknowledging the so-called need for $29 million for school buildings. Acknowledge is defined by Google as accept or admit the existence or truth of. So when you acknowledge the need for this future expense, you are guilty of intent to waste taxpayer dollars on a structure to be built in the future which may fit past needs but probably will not meet future needs. I guess it can always be a nesting place for buzzards. Have a better night and a better year. Bye-bye, y'all.
Thank you, Mr. Winstead. Mr. Floyd, do we have Miss Vicki Richards available?
No, sir.
Let's go back and one last final look at for Miss Boos or Miss Decker.
No, I do not see either one.
Very good. Were there any other folks who signed up that are not here on this list I have? Miss Clerk, Miss Kristen?
No, sir. That's all that I have. And I've double checked my email just to make sure that if anyone was having issues and tried to reach out, that they hadn't previously sent an email, and I don't see anything.
Great. That's good to hear. Thank you for taking that extra effort tonight.
Yes, sir.
All right, then we will move on to item 3 of our agenda tonight, public hearing. This is a request for Unified Development Ordinance Text Amendment 20-UDO-01. Tonight we have our Planning and Inspections Director, Mr. Scott Hammerbacher, who will present this information to us. Mr. Hammerbacher, good evening.
Yes, sir. Thank you. Happy New Year to you all.
Happy New Year to you as well.
So before us, we have a text amendment that was previously heard by the board on December 7th. Per COVID regulations, we're required to wait 24-hour period following that public hearing on December 7th before the board can take an action. I know we do have a couple new board members on here, so just for clarity, going forward, is incumbent upon the board in order to be in accordance with state law that we adopt a consistency statement prior to any action on the zoning amendment. Just real quickly on this. So staff has received a request submitted by a private entity to allow for veterinary hospitals within our light industrial zoning districts. Currently, there are permitted use within our highway, business, office, institutional zoning districts. Also, conditional use and special use, respectively, in our AR and mixed use districts. This previously did receive a unanimous consent or recommendation by our planning board for consideration by this board. And additionally, I am not aware of any comments received during the 24-hour period, nor at the public hearing for the board. The consistency statement we have prepared for the board, I'll go ahead and read it into the record for your consideration The proposed UDO text amendment is consistent with the Comprehensive Development Plan and North Carolina General Statute requirements. Veterinary hospital is similar and compatible with uses already allowed within our light industrial zoning districts. These include, but are not limited to, low impact office, pet cremation, school industrial trade, and restaurants and grills. There are areas within the county of zone light industrial and as identified as employment campuses in the recently adopted land use plan. Compatible land uses identified for this district include corporate offices, single and multi-tenant, professional office, and medical office. This amendment is reasonable and in the public interest. I'd be happy to answer any questions before the board's deliberations.
Any questions from the board tonight?
Vote to approve the consistency statement.
We have a motion to approve by Commissioner Pierce. Is there a second?
Second.
Second by Commissioner Bunn. Any further discussion? Hearing no discussion, we'll go to the roll call vote tonight. Mr. Chairman Bunn, Vice Chairman, I mean, congratulations. Commissioner Foy? Commissioner Jones?
Yes.
Commissioner Speed? Commissioner Speed?
Yes.
And Commissioner Pierce?
Yes.
Commissioner London?
Yes.
And I vote yes, so that is a majority vote, and it is so ordered. Moving on to item number,
I'm sorry, Chairman Shriver.
yes,
We need two separate motions, one on approving the consistency statement and one on approving the actual zoning amendment.
all right, so we just approved the amendment, the text amendment. And so now we will consider approving the consistency statement.
Mr. Chairman, Mr. Chairman, if I can, just to clarify, I believe Mr. Pierce's motion was to approve the consistency statement. Is that correct, Commissioner Pierce?
That is correct.
All right,
Okay,
very
so
good.
now we need to vote on the on the amendment. I'm sorry.
On the text amendment, yes.
The text amendment. All right, so we have, just for record, we have just approved the zoning consistency statement previously read by Mr. Hammerbacher, and now we will entertain action on our unified development text amendment tonight.
So moved.
Second.
I have a motion by Commissioner Bunn and a second by Commissioner Pierce. Any further discussion? Hearing none, we will go to the roll call vote. Mr. Vice Chairman,
Yes.
Commissioner Foy, Commissioner Jones,
Yes.
Commissioner Speed,
Yes.
Commissioner Pierce,
Yes.
Commissioner London,
Yes.
and I vote yes. It's a majority vote and is so ordered. All right, ladies and gentlemen, I think that will then take care of item number 3. And we will move to item number 4, which is an update of COVID-19. Our health director, Scott Levine, will provide an update on the pandemic. Mr. Levine.
How are you this
Greetings.
evening?
Welcome.
Greetings. Glad to be here tonight. I'm going to try and be as brief as possible just to give you a snapshot as to where things are in Franklin County, and then to move very quickly into a discussion around vaccine deployment, which is consuming most of our attention right now. I would first like to speak to a concern that was raised earlier in the evening around access to testing. We have not decreased our access to testing. So I will look into what might have happened with the drop calls, but we had excess capacity for the last month or so, and so if anybody needed it, they were able to get it. So I will explore that. Currently, right now, we have reached the highest numbers of cases that we've ever seen in the history of the pandemic in Franklin County. We had our highest case single day total of 114. That occurred in a single day, December 31st, the last day of the year. That is significant in that it translates to 557 cases every 2 weeks. And for the month of December, we saw 1,164 new cases of COVID in Franklin County. Each one of those has to be contacted for a case investigation, And then from that, up to 6 to 7 in many cases, individuals need to be contacted as a result of that. This is a monumental undertaking. We have reached out to the state and have elicited their support in getting access to additional case investigators. They should come online next week for us. And then contact tracing, we have employed and have been using the state's contact tracers for several weeks now. And that has been a big help. With the massive number of cases, case investigation will be the next piece that we can use assistance with, and we are getting that. Everything at this point is pretty much shifting as much as we possibly can to vaccine distribution. We received our first doses of the Moderna vaccine 2 weeks ago, and we received a dose, an initial shipment of Pfizer vaccine last week, and we will receive an additional shipment tomorrow of the Pfizer vaccine. We opened our first drive-through clinic for those designated as phase 1A eligible. Those are healthcare workers directly treating those with COVID-19. That includes hospitals, urgent care staff, and EMTs who are directly treating COVID-19 patients or transporting them. Healthcare workers directly testing or vaccinating COVID-19, and any support staff or other professionals involved in that work, and long-term care facility staff and residents. We immediately reached out to all of the long-term care facilities, including family cares programs that did not participate in this, the federal program for vaccinating those facilities, which was run and is being run by CVS and Walgreens. There were about 91 beds, and it turned out to be roughly a universe of about 300 individuals, including staff and residents of those facilities, who needed to be contacted and offered the vaccine. We began vaccinating some of those individuals and all of the people in phase 1A last Thursday. We vaccinated 82 to start with. We have our second round of vaccinating that population tomorrow at the health department. And then on Thursday, we will be opening it up to persons aged 75 and older. Those are persons now classified in group 1B, phase 1B, group 1. This becomes very difficult to follow. So we have set up an email address where if you have any question about the COVID vaccine in Franklin County, send your question to covidvax@franklincountync.us. This will be sent to all of you, in addition to the dashboard that was completed for this week that will give you all the updated numbers. When you send an email to that address asking your question, most of your questions will be answered in an auto reply that comes back to your email from wherever you sent it. It will give you detailed explanations about who we're currently seeing, how to access the vaccine, and when you can do that. So that is going to be updated daily because the guidance for us is changing daily in terms of who's eligible and when. Our goal at the health department is to get all of this vaccine into the arms of every person that's eligible as soon as they're eligible and as quickly as we conceivably can. We have been working extensively with EMS and Hendricks Valenzuela, his team, to get our first drive-through set up and a resounding success. I'm very pleased with the cooperation and the team spirit that we've seen all the way around. And we've gotten great feedback from those who came through it, who had actually experienced real problems in other counties that were trying to run events. So we're really pleased with the direction we're going. As this expands, it will into greater population groups, larger population groups. We will be leaving the health department and moving it into locations that can handle large volumes of individuals. But at this point, the distribution point is the health department. One fly in the ointment, we did not count on getting any Pfizer vaccine, and we are getting 2 shipments of that. The Pfizer vaccine is incredibly difficult to store. we have to order and keep on hand dry ice. It has an incredibly complex defrosting process. And once we defrost it, we have to use it within 5 days or we have to throw it out. So it is very, very unuser friendly. And so we are trying, it's very effective, no question about that. But from a distribution point, very hard to put out. So we're going to do the best we can to get all of it out, including the Moderna. And you'll be seeing more information coming out. You'll be hearing press releases coming out, and that email address will be updated daily with information on who's eligible and when. So I think that's pretty much everything I can give you in a nutshell. Are there any questions?
Any questions from the board tonight?
I have one.
Yes, sir. Go ahead.
Scott, given what we've seen with other states in Florida and Tennessee and all the people standing in line all day long, are you making efforts to make sure we don't have that problem here in Franklin County?
I'm going to do everything in my power to make sure that that does not happen. We, right now, because the number of people who are eligible, 1B, group 1 population, that's about 8,000 people in Franklin County. That's not a large number, but if they all try to come at once, it could be. So there's a process that we have to register them, so they have to give us information, and that's a choke point right now. So we can do that at the health department right now. When it opens up to the 1B group 2, which is a far more extensive list, at that point, we're really hoping the state's going to have the portal open so individuals can register themselves, pre-qualify. By that point, we are moving into situations that can handle larger numbers of people. And we're doing it in a drive-through with a walk-up option in all locations. And we're going to be able to handle that number. We are not going to make people wait, and we're going to do multiple events rather than one event where people have to wait all day.
That sounds great.
Thank you.
Any other questions from the board?
Mr. Chairman, I have a question.
Yes, go ahead.
For Mr. Levine. When will the second drive-through be available for the public for the vaccine?
The next drive-through that will be available for group 1B. The 1A group is tomorrow. The 1B, and that is from 1:30 to 3:30 here at the health department. Again, these are people that have pre-registered. The next group for persons age 75 and older, we opened that up registration today. We will be vaccinating individuals in that group starting this Thursday, the 7th, same time frame, 1:30 to 3:30. It'll be here at the health department. It is a drive up. You do have to have an email address, but there's a non-email address option we can do, but it's much easier if you have an email address. So we just need 2 pieces of information: a legal first and last name, no nicknames, no also known as names, though no usually called names, your legal name, and an email address. If we have those 2 pieces of information, we can get you registered and you'll get the next step and what you need to do to get yourself over here. So that's what we're going to need next.
Thank you.
You're welcome.
One more question. Given that information, what about the next group, the 65 to 75-year-olds?
Yes, the next group is the 65 to 75-year-olds, and that is in.
Mr. Levine, when you're not facing your computer like that, we lose you.
Gotcha.
Yep.
The age 65 to 75-year-old group is after group 2. So there's 1B, group 1, group 2, and group 3. Then it goes to group phase 2. And group 1 and phase 2 is anyone 65 to 75 years old. So anyone in that group. And then it goes to group 2 in phase 2, and that's anyone 16 to 64 years old. So that's pretty much opening it up to almost everybody else. But with that group is with a high medical risk. You can see there's so many permutations that they put on this. That what we're going to do is when you get that email, it's going to show you who's eligible now, and then it's going to show you who's eligible next. So that list that you see is everybody that can register right now, and that's it. then as we add that next group, that list will be inclusive. Everybody that's a member of all of those groups, you can call up, you can go online and give us that information. We can register you.
Very good. So would it be possible, I'm sure it would be, but I would think it would be smart of us to maybe put this little blip about the email, the COVID vac email, on our homepage for the county. It's maybe what you see when you first go to our homepage, so that people immediately can find it. They have to look for it or dig for it. It's right there, boom. I mean, if it's on the health department's page, that's wonderful, but I think we need to get it up on our homepage for just the county itself. It's a broader message.
Yeah,
So
that is the game plan. We just created it last week, tested it with an initial message last Thursday, and then updated it for the first time today. So
Very
yeah,
good.
the plan is to publish it, to get it out to the information on the JIC line, the nurses that are answering that phone, the Joint Information Center line, to get it on the alert page, front and center of the county's website. And it'll be on our Facebook page, our county health department Facebook page as well.
Very good. One other question is, have we seen any more deaths? We talked about the number of cases in December. Have we had any deaths in December from the COVID in our county?
Yes, unfortunately, we have had an additional, two additional deaths. One was in December, and one, unfortunately, was in the health department. Was the spouse of a health department employee. You know, I can say that it gets real when you know somebody that's died.
That's right.
And this is the second person that I've known that has passed. And so, you know, it gives more pressure on us to make sure that we get the message out, because in this particular case, it was a workplace exposure that caused it. It is avoidable. It's completely avoidable. So wear a face mask whenever you can, when you're out and about with people. So, yep, that was one additional death that's occurred in the first of the year. We haven't had any more at this point.
Okay, very good. Thank you, Scott, for all the information.
Thank you.
Was there a question?
Yeah, questions. Levine, have we had any cases of the new variant in the county?
None that I'm aware of in the county, and none that I'm aware of in North Carolina yet. The only new cases that I'm aware of the new variant have showed up in California. I think there's some in New York, where you would expect normally those cases to kind of show up first. They're in major transportation hubs. You know, we're going to watch it. It is more contagious, but it's not more lethal. So it has the same level of lethality so far. It's just much more contagious. It's much more readily transmittable between people. And so that's not going to bode well as we've got these numbers going up. If that hits us, we're going to do all that we can to get as much vaccine into the arms of as many people as we can. The data that's coming out shows that it should be it should be fine for this new strain. It's not a significantly different strain, so it's not going to need a new vaccine. So this one vaccine is going to be good for the new strain as well. But the more people we can get inoculated and vaccinated, the better we're going to be.
All right. Any further questions, Commissioner Speed? I'm sorry, I'm having a hard time hearing you. Is that a yes or no?
No.
All right, very good, very good. Any final questions for Mr. Levine tonight from the board? All right, again, thank you very much for all your efforts, and to your crew and staff who are working diligently, thank them for us. We greatly appreciate all their efforts.
I certainly will. Thank you very much for all your support.
Yes, sir. Have a good night.
Mr. Chairman, if I could just check with Mr. Floyd and make certain that Commissioner Foy is not now on the line. I haven't heard from him recently.
Sure, go ahead.
No, I've been checking for him. I still do not see him.
Okay. All right. Thank you.
All right, very good. All right, we'll move on to item number 5, the Franklin County 2021 COVID-19 leave. The board is being asked tonight to consider provisions for employee paid sick leave made available due to the coronavirus COVID-19 related reasons and to identify the benefit as the Franklin County 2021 COVID-19 leave. I believe our county manager, Ms. Denton, is going to take this for us tonight.
Yes, thank you, Chairman Shriver and commissioners. First of all, I want to say I appreciate you all allowing this to be added to the agenda tonight. As the year drew to a close, it became apparent that this issue needed a little more timely attention because of all that's happening with the coronavirus throughout our county. And as the chairman indicated, this is a request for the board to extend a provision for employee paid sick leave. This employee paid sick leave was originally part of the Families First Coronavirus Response Act that was effective from April 1st of 2020 to December 31st of 2020. And of course, that expired on December 31st and was not renewed by the federal legislation. But counties have the opportunity to extend this. And so basically the guidelines include details for providing paid sick leave for full-time, up to 80 hours, and part-time, their 2-week equivalent hours, employees that are impacted by COVID-19. And based on, of course, the continuing impact of COVID to our Franklin County employees, I'd like to ask the board to consider continuing this provision for our employees. It will use the same guidelines and rules as the expired legislation from 2020. The provision will be available to employees who have not previously used the provision in 2020. So employees that are newly impacted or that fall under the qualifications would have the opportunity to take advantage of this benefit. And the requested time period for the extension is until March 31st of 2021. And I'll be glad to answer any questions or provide any details. Again, I appreciate the consideration for this. We have had a number of cases identified within our employee ranks. And so we're doing everything we can to encourage people to prevent the spread by having the opportunity to stay at home and wait for test results and take care of loved ones.
Mr. Chairman, move to approve.
Second.
We have a motion to approve by Commissioner Pierce, a second by Commissioner Speed. Any further discussion or questions tonight? Hearing none, we'll go to a roll call vote then. Mr. Vice Chairman?
Yes.
Commissioner Jones?
Yes.
Commissioner Speed?
Yes.
Commissioner Pierce?
Yes.
And Commissioner London?
Yes.
And I vote yes, so majority vote here tonight, and it is so ordered. Thank you for that, Ms. Denton, and for bringing that to our attention. That's good that we are making additional considerations for our staff and employees so that they can take care of what they need to do and be able to come to work healthy. So
yes, thank you very much.
All right, we'll go on to item number 6 tonight, which is an acknowledgement from the North Carolina Department of Instruction Facility Needs Survey. I'd like to welcome Dr. Schuler, our school superintendent, tonight. She is here also with Dr. Webb. And good evening to both of you all.
Good evening. Can you hear me?
Yes, ma'am, I can.
Okay, good. Good evening, Chairman Shriver and members of the Board of Commissioners. This evening, we are with you to provide you with information as part of our 5-year required facilities report to the Department of Public Instruction. So districts complete this report as a way to monitor the condition of facilities within individual LEAs and to identify priorities for maintenance, for repairs, and for future replacement or expansion. Our Board of Education has been actively involved in determining and prioritizing our facilities needs. Paige Sales, our board chair, is in the audience this evening as a representative for our Board of Education. Dr. Webb will be sharing a bit more about the efforts that have taken place when he reviews this information with you. But I will say this is a culmination of many hours of work on the part of our maintenance department, school leadership, and our Board of Education. Before he begins, on behalf of the Franklin County Board of Education, as we begin a new year, calendar year, I'd like to thank you for your ongoing support of our district and our students, our families and staff. I do look forward to joining you at a meeting in the near future when I can provide you with the state of the district. We do that annually, and when I'll be giving you this information, I'll provide information on operations and just the state of the district. And this has really been an unprecedented year for not just the school system, but for our entire community. In spite of the challenges, we are proud of the work that is taking place in Franklin County schools, and we couldn't do what we do each day for the students of Franklin County without the support of our Board of Commissioners. So we appreciate you. I look forward to working with each of you moving forward. At this time, I am going to turn things over to Dr. Larry Webb. He's our Chief of Auxiliary Services, and he will be providing you with an overview of our 5-year plan that we have developed for facilities. So I'm going to turn things over to him at this time. Thank you.
Thank you.
Thank you, Dr. Schuler. I'm hopeful you can hear me and see our presentation at this time.
We can.
That's great. Well then, good evening, Chairman Shriver, Commissioners, Madam County Manager, and everyone in attendance. Thank you so much for the opportunity to speak to you tonight, and I bid you all a Happy New Year. After several months of work and several hundred hours of work, I'm pleased to present our North Carolina Department of Public Education Facility Needs Study. This required document is prepared by North Carolina Public School Systems and is submitted every 5 years. It's important to note that most of the dollar amounts in this study are established using the North Carolina Department of Public Instruction calculations, and these are projections, not quotes. The actual cost may vary depending upon when a project is undertaken and multiple economic and environmental factors. Additionally, DPI standardizes costs to a statewide average to provide uniform comparisons. Our survey has been completed using a lot of data from our current capital improvement plan, observations from the Franklin County School Board of Education, and Franklin County School Board staff, and our strategic plan. The survey requires approval by the Board of Education and acknowledgement of receipt and review by the county commissioners. The projects here represent observations and priorities from the Franklin County Schools Board of Education, Franklin County School staff, and our current capital improvement plan. Most of the projects reflect our conversations centered around HVAC systems and our roofing systems. To further determine our needs, the Franklin County Schools Board of Education visited all of our facilities with our superintendent, your Chief of Auxiliary Services, that would be me, and the Director of Maintenance. Board members received enrollment information for each school, facility history for each building and complex, the strengths and needs as they walked into each building. Each school principal conducted on-site tours. Board members then met after each session to discuss the needs of each facility. Everyone got on a bus, we went to the schools, and then we came back and we had a conversation. Data from those sessions and our long-range plans have driven the data that you'll see in the DPI Facility Needs Survey. So here are the sections of our survey, and I will delve a little more into those, or more if you wish, but cost details, and this again is given to us from DPI. Cost details years 0 through 5, cost details years 6 through 10. We have replacement school information in this study, and then the certification document. So let's take a look. Here's our 0 through 5 study, our 6 through 10. I'll pull up the 0-5 document. There's a worksheet for each school. So every project here is represented by multiple pages of evaluations and estimations, and I'll show you very quickly what those look like. Here we see the one for Bunn Elementary, and it's divided by additions, renovations, and furnishings, and other things, other improvements to the facility. Everything is justified and balanced. And again, those figures are plugged in and given to us on the basis of factors like square footage or the total going price that DPI has determined. Here's an example at Bunn High for a roof replacement, 18,173 square feet of the facility. It gives us the price and it calculates that. So it's a lot of information, a lot of pages. I have summarized that. I can get to it for us. Let's see, get it. All right. So this is a summary of those multiple pages for the 0, 5, and 6, 10. The column on your left represents our 0 through 5 projects. There's 0 year through year 5 projects. And on the right, years 6 through 10. Broken down by school and by project with a projection of what those improvements will cost. And it is a graduated scale in that a project done in the first 5 years, if you move that to the second 5 years, the cost estimate, the projection goes up because it's calculating economic considerations. That's why I mentioned earlier that these could vary on the basis of when we undertake the project or if we undertake the project. So that is our summary of this document. So our progress and the next steps. The 2020-2025 facility needs survey has been approved by the Franklin County Schools Board of Education on December 14th of 2020. Tonight, we present this to you, the Franklin County Board of Commissioners, for signatures of acknowledgement. Now, this is not for approval or any type of financial commitment. There's a lot of things that can happen between now and the completion of this, the length of this study. At this point, we are simply presenting it for your, presenting it to you for your acknowledgement and giving you the opportunity to review it. After your approval, or signature, not approval, excuse me, maybe be careful there, not approval, after your signature of acknowledgement, we will submit this to the North Carolina Department of Public Instruction. So at this point, I will try to answer any questions that you may have for me.
Any questions from the board tonight?
Yes, I have a couple.
Go ahead.
Dr. Webb, given your information, and I recall some of these things being replaced in years past, what is the average life value on HVAC system in Franklin County schools?
We're told the industry standard is 20 years. Many of our systems are much older than 20 years. And so an example of that would have, if you look back, as we're moving towards the end of this study in the 6 through 10, some of our newer facilities are looking at roofs and HVAC systems. But we use the figure 20 years. Hopefully it lasts that long. We've got several that are in that boat right now.
Okay, for newer schools, particularly Franklin High School, what is the average life value for roof in Franklin County schools?
We hope it's between 20 and 30 years. It's also based on any damage or based on any problems that we experience. Every facility of the size of a school is going to have some leaks. We respond to that. We repair. We estimate 30 years. Our new roofs that with the kind assistance of the county commissioners do have a 30-year warranty, and anything that we do new will have a similar warranty. We have a mixture of shingle roofs, flat roofs, and metal roofs, and each of them have their own challenges and their own deltas and positives and deltas. So we're hoping for 30 years, but we evaluate each one of them individually.
And my last question is, given the information for tonight, do you all plan to prioritize your most needs for the coming budget years?
Well, our budget needs for the coming year, yes, sir. Many of those you will see are going to center around, as they did last year, working with roofs, working with HVAC. That plan will most likely have a lot of repairs as opposed to a full replacement, because a full replacement of an HVAC system or a roof is between $1 and $3 million for our facilities, and maybe more in our larger facilities. So we every year for our budgetary needs for the year, we use our existing 10-year study, input from our principals, evaluations from our Franklin County Schools staff, and look at our needs. As always, there's more needs than there are funds, and we prioritize every year on the basis of what we feel like we can get done with the amount of money that would be requesting from the county commissioners, and also as a triage to use them with a nod to our medical friends. What is the most urgent need? And we look at that every year to prioritize. This study, the information from this study will help us guide that, help us prioritize, help us remember we've got to do these things. We've got these things on the books. We've spent a lot of time with this study, not just filling out the paper or filling out the website, but actually going into the facilities and looking. So yeah, this is our guiding document for us, and we will treat each year as it approaches itself. But this year, this document will help us think long range. I hope I answered your question.
Thank you.
Thank you.
Any other questions from the board tonight? All right, well, thank you for the presentation tonight, Dr. Webb. Dr. Schuler, again, thank you. It's always good to see and hear from you. And I also don't want to leave out Chairman Sales, Paige Sales tonight. I don't know if you're in the audience anymore, but we want to welcome you as well tonight with us.
He's still here. So thank you so much. We appreciate it.
Very good. Thank you again.
Thank you all very much. The confirmation document is included in your package. You will see that our chair, Ms. Sales, has already signed the document, and it is awaiting acknowledgement from the commissioners. Thank you for your time, and thank you for all that you do for the children and the employees of Franklin County Schools. We appreciate you all.
Thank you again. All right, then moving on to our next item tonight, number 7, the Northeast Area Study Update. This update's going to be brought to us tonight by, again, our Planning and Inspections Director, Mr. Scott Hammerbacher.
Yes, sir. Thank you for having me. Just want to give you a quick update this evening. I have folks from the Capital Area Metropolitan Planning Organization, or also known as CAMPO, involved, Brandon Watson, and their sub-consultant, Mike Rukowski with Stantec Engineering. The Northeast Area Study, just as a reminder, was last adopted in 2014. It does cover the Northeast area of the county, but does cover many of our communities, including Bunn, Youngsville, Franklinton, as well as Wake Forest. Also, the surrounding communities include Wendell, Nightdale, Zebulon, and in addition to Wake Forest, Wake County, and Raleigh. So it is covering a very large geographic area in a rapidly growing area. As I've noted, it was updated last in 2014. Right now, just to throw that out there, did a quick math. Right now, we're looking at over 7 folks moving into the county every day, just in Franklin County, not considering our surrounding areas. And as many of you are aware, many of the roadways within Wake County, including 401, US 1, have direct impacts on our county residents. So with that being said, I'm going to turn it over. I believe Mr. Burkowski with Stantec Engineering, who's working on behalf of Campo, is ready to give the board a quick overview of where we stand with the update to the study. Thank you.
Perfect. Thank you, Scott.
Thank you.
And Scott, can you confirm you hear my voice?
We can hear you.
Awesome. Terrific. Well, thanks, Mr. Chairman and commissioners. We want to spend a few minutes here, give you a new, the second update. We call them the board briefings for the Northeast area study. And Scott did a wonderful job kind of introducing, how do we get to this point? I remember working with Scott back in 2013 on the same project. So it's really an update, focus drilling down a little bit more detail and moving forward. So let's jump right into it. We also have Brandon Watson, who is the Campo representative. He's the PM on this project, on the phone as well. So we can ask about interesting questions relative to funding and the like. So where we're at, we're going to cover where we've been, who are the folks that we talked to, what are we doing now with our time, what are we focusing on, and then where we're going to be heading in the near future. Let's start with where we've been. So back in April 2020, April through July, we initiated the project with some outreach. We did an interactive mapping. I'll show you a little bit of that. Did online survey, almost had 500 responses to that survey. We do have a website. We encourage you to go there and collect a lot of information already. It's not too flashy. It's the niceupdate.com. We've already had 3,000 folks visit that website, and it's a groundswelling. It's really providing better information, research documents, plan recommendations as we go along. Now because of COVID, obviously the virtual discussion is more rampant. We are involved more with WebEx and Zoom meetings like the one we are today. Part of that are some of the tools that we use. Stakeholder interviews back in May, where we talk about constituents focusing on transit issues or bike advocacy or emergency fire and rescue. So a lot of good conversations there. Public symposium, there are a couple of them back in June. And all that means is just an open house where we talk about issues and problem areas and some solutions to those problem areas. All along, we're working with what we call a core technical team meeting, which Scott Hammerbacher is part of that and his constituents. And they basically provide us guidance. They're our advisory committee, if you will.
Timothy, can I get you to pause for just a second? I think we got a little bit of an IT problem with sound. I want to be sure all the commissioners can hear us. Commissioner Floyd, I've got one person said they got sound back now. Everyone hear me speaking? Anyone not hear me, give me a thumbs down or something. All right, very good. Please continue then. Thank you, Timothy.
Yeah, and Michael, if that continues, just give me a hand signal and we'll confirm too. So
very good.
Real quickly,
Thank you.
The interactive mapping is kind of a cool tool, not very expensive, but a lot of great information that came from that. Like bottom left-hand corner, those are all the areas in this area. It's 375 square miles, so it's quite large. Bunn's in there, Youngsville, Franklinton, and the like. So you can just imagine how large or massive this effort is. Looking at land use and transportation, we're collecting a lot of good information specific to problem areas like barriers to walking and biking, the bottom left-hand corner. Top right-hand map, our safety and speeding issues. So we're able to kind of drill down a little bit about some of the problem areas. It even asks folks, you see the map to the right, about some of those problem areas and things that they want to share solutions to. We're also asking them interesting questions like, hey, if you had $100, where would you spend the money? And the takeaway here, which is quite different than 2013, is we're seeing a lot more folks interested in non-motorized mobility. Bike, ped, transit, trail connections was a huge response from the Franklin County representatives and participants as well. So that was interesting. Also, bottom left-hand corner, where do we want to focus our development interests, right? And what we're hearing are infill areas, basically the downtowns and areas that are already developed. Michael?
Let me put you on hold for just one more second. Sure. Commissioner Bunn, are you able to hear us?
I can hear you fine, Mike, but when it switches over and whoever's talking is talking, I can't hear anything.
Does anyone else have that problem?
I don't, Mr. Chairman.
Okay. Commissioner Pierce, what did you say? I'm sorry.
I said I do not have that problem.
All right. Very good. Very good. Mr. Floyd, do you have any suggestions for us on IT side?
No, sir. I'm looking to see if there's anything that I can do, but I don't see anything at the moment.
Can you hear me now, Commissioner Bunn?
Bring it closer.
Yeah, I hear you fine.
Yeah. Okay. Let's proceed then. Let's try it again. If that doesn't work, I might have a different suggestion or idea.
Can you try to turn your volume up a little bit? Mr. Ratisky?
It's wide open.
No, Mr. Ratisky, turn your volume up just.
We'll try, yeah. Mine's all the way.
Okay.
All the way.
Hearing volume. And if this does work, let's get Brandon. You might want to finish up and present on this if you want.
Okay.
Can everybody hear me?
Commissioner Bunn, can you hear Brandon?
Can you hear me, Commissioner Bunn?
I think we may have lost him.
Mr. Chairman, I'm also getting a message from Commissioner Speed that says he's having a hard time staying connected as well. I don't think that's an issue that we can help out with, but that may be why he's disappearing from time to time.
Okay. I can't see everybody on the panel on the current. When the screen is shared, it reduces us down to just 2 or 3.
Yeah, I think it looks like Commissioner Speed is connected at the moment.
What about Commissioner Bunn? Is he still connected?
I think.
Yeah, I'm
Commissioner
back now,
Bunn-
Mike.
Okay. Yes, he's still there.
Okay. All right, let's proceed then with it. Mike, I'd say continue. I've got a possible another connection point that I can make to help Commissioner Bunn here.
Perfect. And honestly, we have a voiceover on this entire presentation too that we can share afterwards. How's that?
Very
just
good.
for clarity.
That'd be
Yeah.
great. That'd be good.
And Brandon, if you could pop that in and give that to Scott Hammerbacher, that would be awesome. So only a few more slides. I just want to jump back into that. Our virtual symposium, which is just another fancy name for an open house. We did a lot of interaction going on with folks, constituents, citizens. And some of the key takeaways here, I just picked on a few. We asked some like pop-up questions, like push button or instant polling, actually on a virtual meeting. And it was great, some of the results. Things that popped out at me that were interesting, like roadside improvements, roadway improvements, traditional widening. Yeah, people supported that, but they really wanted to fixate on complete streets, providing for all modes. That was pretty interesting. Second to that was 35%, and that was dealing with or fixing congested corridors. Down the bottom left-hand corner, what do you want to focus our attention on in multimodal choices? Really, it was greenways and trails receiving 85% of the votes, followed by about 40% conserving conservation areas like the Green Heart. And that's really the watershed area that's centralized in this entire study area. So after understanding what all the data tells us, congestion, safety, and then what the people tell us, we really brought it down into 6 distinctive guiding principles. I'm not going to go through all of these, but the things that pop out to me were, number 1, mobility choices. People wanted more. Wouldn't it be great if we had more than just one choice to go to work or to go to medical appointments or to go shopping? And so that was mobility choices, and providing more than just one mode was something that folks really supported. Redefining infrastructure. What I mean by that is we understand the funding shortfall that we're going through. NCDOT 8 months ago announced $750 million over programming, which we'll never see again. And so protecting the infrastructure, what we have, it was vitally important. We've got to be more fiscally and financially constrained when we do that. So that's really one of the overarching themes of this entire study. Connectivity, really important. Franklinton was one good example. I think Youngsville as well. Better connections getting across railroads, getting across freeways, interstates, and the like, US 1 being one of them, is really critical. So better connectivity, working with the development community, and they're the ones that basically build the 2-lane, 3-lane roads through development. We really got to provide better tools for our practitioners that are requiring that of the development community. We did take a look at growth and land use, and these are just a series of maps that show the results of those growth scenarios on our transportation network. Red means bad, green means good. And so even when we went through the entire exercise, the left one is business as usual. The way we're growing, that's reflected in your comp plan, all the way over to scenario 4, which is a modified combination. We asked practitioners like Scott and some of the other representatives to talk about, where do you want to grow? Where's the highest and best use, and where do you think the growth pockets will occur? When we did that and you drilled down, there were some nuances to see how well or how bad that performed. Nodal density was a keen interest of the practitioners, and really protecting that green heart area, the watershed area, if you will. We're even taking a look at some of the numeric values of that exercise. We called it a building block exercise. From that, I'll just pick on one factor that popped out at me. The practitioners, the planners, engineers really honed in on new homes and walkable areas. In other words, density drives walkability, which is really, really interesting. They want to put the density towards those key corridors, like transit corridors, if you will. So, and that kind of makes sense. But we also want to recognize reducing vehicle miles of travel and hours behind the wheel, which is still very important. So where are we now? We've gone through the discovery. That's the due diligence phase. We're into analyze. We've done a lot of that already. We're doing some hotspot concept designs. We did one last year in 2013 with Bunn and their Main Street, Youngsville and their Main Street. We're doing a number of them as we're moving along. We're really now fixated on the recommendations for all modes: bus, bicycle, pedestrian, vehicular roadways, connectivity, you name it, even freight mobility. Hopefully we'll get this completed about the end of April, and then all that's left from there is really just the adoption process. And we took a look at, we got to validate the existing adopted Metropolitan Transportation Plan. So we need to validate that. And that's a reflection of some of your local adopted comprehensive or locally adopted transportation plans. So we're looking at that. That'll include facilities like widenings, new location, as well as access management, cleaning up some of those problematic corridors that have a plethora of driveways or very confusing because lanes drop one corridor or another. So that's where we're at. This gives you a snapshot of what that looks like. Next, we're also looking at alternative modes like bike ped transit. You can see the map on the left. We're breaking those into tiered groups: near-term improvements, mid-term, and long-term. You can see it goes all the way up to Franklinton, trying to take advantage of some of those collector streets along the US 1 corridor. Might be of interest to you. Some key corridors like 39, 56, 98, you name it. Some of those more rural, longer corridors that go through the entire area. We still want to provide amenities or at least treatments for bicycle and pedestrian. Transit concepts, we are supporting the East Transit Commuter Rail, which is highlighted down there through the Knightdale and Wendell, Zebulon area. We're also looking at a connector, more of a transit circulator, hopefully being paid through the Wake County Transit Plan and the opportunities they're providing for local services. And so now where are we heading? There's a couple slides left. Really, we're refining those recommendations. We'll be working with our committee, as well as getting back out to the public, probably in the February, early March timeframe, with another series of open houses, another survey to ask them about prioritization, where do we spend our money, and then providing updates to the website as we go along. Ultimately, the culmination of this effort will help Campo populate their next update of their 2050 Metropolitan Transportation Plan. And you may recall, this has to be financially and fiscally constrained. The money that comes in has to go out, and no more can be added to that. Again, completion around the April timeframe with final adoption thereafter. The one thing that I think, Brandon, I'm going to chime in and have you chime in here. This is our last slide, but if you guys know of certain events, maybe a farmer's market and maybe a festival that's coming up in the March timeframe, April, let us know. We want to tag team on that and do what we call traveling roadshow events, where we bring out a map, maybe a booth, and ask people certain questions. But As always, Brandon Watson is your project manager with Campo, and there's his contact information. I'm going to stop there and open it up to any questions that you might have.
Any questions at this point from the board? Thank you, Mike, for that presentation on that. I guess Brandon's got some things he'd like to share.
I was just gonna add on to this slide. Yeah, we really could use your help if you know of any groups or organizations or even community leaders that could help us get the word out for this. You know, we're doing this study mostly all virtual at this point. So any help you could provide on contacts, or if there's any newsletters we could get in the next couple of months, we would really appreciate the help.
Very good. I'm sure we can connect you with a few communication points we have through some organizations here in the county for sure.
Thanks for having us.
Absolutely. Thank you for your presentation. Mr. Hammerbacher, you have anything you'd like to add?
No, sir, nothing at this time. Thank you for your consideration.
Absolutely. Thank you for sharing this with us tonight. All right, ladies and gentlemen, we'll move on to item number 8 tonight, which is appointments. Letter A is the Car-Tar COG Board of Directors. Per the Council of Governments bylaws, this board is asked to appoint one county commissioner to govern the Board of Council.
Mr. Chairman, I would like to ask that we table this until January the 19th.
All right, is that in the form of a motion?
It is.
All right, so we have a motion to table this appointment until January 19th. Is there a second?
Second.
Second by Commissioner Pierce.
Yes.
Any discussion at this time? Hearing none, we'll go to a roll call vote then. Mr. Vice Chairman?
Yes.
Commissioner Jones?
Yes.
Commissioner Speed? Did we lose Commissioner Speed?
It looks as though we may have, yes, sir.
All right, very good. Commissioner Pierce?
Yes.
Commissioner London?
Yes.
And I vote yes as well. Majorities have the vote, and it is so ordered. Thank you for that. We move on to letter B. The North Carolina Association of County Commissioners is asked to, each board to designate a commissioner or an official as a voting delegate to their North Carolina Association of County Commissioners Legislative Goals Conference. This is scheduled for January 14th and 15th, which is next week, and the conference will be held virtual in a virtual platform. Each county may also assign one alternate voting delegate. The NCACC must be notified of this selection voting delegate by close of business on January the 11th.
I would like to nominate Michael Shriver to be our delegate.
All right. Are there any other? We got a second by Commissioner Pierce. Are there any other nominations? Hearing none, we will go to a roll call vote. Mr. Vice Chairman?
Yes.
Commissioner Speed? Still not available. Commissioner Jones?
Yes.
Commissioner London?
Yes.
And Commissioner Pierce?
Yes.
All right. And I vote yes as well. Majority has it, and it is so ordered. Now we need a secondary delegate to serve in that absence. Do we need to, Madam Clerk, do we need to do that as well?
It might be a good idea just to have another commissioner as an alternate, just in case something happened and you could not attend the platform. Again, it's all virtual. And while I have the floor, I would like to encourage all of the commissioners to attend this year. I don't think there's any charge associated with it, but it would also be a great chance to just really be informed and see how this process works. And to recall that we've submitted a legislative goal regarding broadband for this year.
All right, very good. Thank you for that. So for a voting delegate in the unlikelihood that I'm not able to attend next week, is there anyone here on the board that has any interest in being that alternate? Hearing none, I nominate Commissioner Jones. That's a motion.
Mr. Chairman,
Yes.
I'm already the district representative for the area. Okay, I'll be there already.
You already be there. Okay, very good.
I don't mind being an alternate, but I'll already be there.
Okay, very good.
Yes, sir.
Okay, well then that would be good if you were already going to plan on be there. That for some reason I can't be. That would. Is there any other commissioners that are already going to be a part of that?
I'm not aware of any plans, Mr. Chairman.
Okay. All right. Well then, Commissioner Jones, if you're willing to do that in my absence, should that occur, which I'm not counting on it, I would be grateful.
I'm looking forward to you being there because I'm not there.
All right. Very good. So there is a motion on the floor and a humble acceptance. Is there a second?
Second.
Second by Commissioner London. So we go to a roll call vote for Commissioner Jones to be my alternate. Mr. Vice Chairman?
Yes.
Commissioner Jones?
Yes.
Mr. London?
Yes.
And Commissioner Pierce?
Yes.
Very good. And I vote yes as well. The majority has it and so ordered. So it will be myself and Commissioner Jones as an alternate for this agenda item tonight. All right, moving on then to number 9, other business. Is there other business tonight that we need to bring before the board? Anyone have anything that they feel we need to address? All right, well, hearing nothing, we'll move on then to number 10 on our agenda tonight, which is board manager and clerk's comments. This is the time that's set aside on our agenda for the Board of County Commissioners and the county manager and the clerk to report on various activities. The board may also discuss other items of interest. Madam Clerk?
Mr. Chairman, I don't have anything at the moment. I've provided you with just a couple of notes, so I think that will suffice for me tonight.
Very good. Thank you for that. All right, then our county manager, Ms. Denton.
Thank you. And again, thank you, Chairman Shriver and commissioners. I'd like to take a moment to introduce, and I did mention this at the last meeting, but tonight, Hendrix Valenzuela is able to join us. And so I'd just like to take a moment to introduce you to our new Emergency Services Director for Franklin County. Hendrix Valenzuela comes to us with a host of experience. He's spent some time in the fire service. He's been an EMT. He's been a multi-hazard field planner with North Carolina Emergency Management. He has come to Franklin County officially on December 14th, but he has hit the ground running. His first week here, we had a slight chance of a weather issue. He was monitoring that very closely. Toward the end of the week, we had a missing person situation that resulted in a search. And since then, things have continued to accelerate in the emergency management area, emergency services area. So I welcome Hendrix. I encourage all of you to reach out to him with any questions you have about his area. But Hendrix, I'll turn it over to you in case you have a few words you'd like to share tonight.
Yes, thank you, Kim. Good evening, commissioners. I just want to take a few moments and say I'm honored and privileged to join the Franklin County team. I look forward to continue to work with county management and continue to work with our internal and external partners to make sure that we deliver adequate emergency services, just like we've been doing with public health. It's a joint juncture. So again, thank you so much for having me.
Thank you for being here. Welcome.
Thank you.
And Chairman, I don't have any other updates at this time. Be glad to answer any questions anyone might have.
All right. Any questions for our county manager tonight? All right. Hearing none, I'll move on to myself. I just want to remind everybody that our next board meeting is on a Tuesday night, the 19th, following the Martin Luther King holiday on Monday, the 18th. So please mark your calendars or be sure that your calendar's up to date, that is a different date and day than we normally attend. All right, that was the only thing that I had to share. I got the other ones already taken care of with the conference. Again, just encouraging those that you want to attend or want to jump in on that conference on the 14th and 15th. Just need to make our clerk aware of that. So I'll move on to Mr. Vice Chairman. You have any comments tonight?
I have no comments tonight, sir.
All right, thank you, sir. Commissioner Speed never made it back with us. Commissioner Jones?
I have no comments.
Comments. Commissioner Pierce?
Yes, sir. I have a few items of interest I'd like to speak.
Sure.
First of all, earlier tonight regarding the Animal Advisory Board reinstatement, I am all for that, and I'd like for that to be addressed at a future meeting. Second of all, broadband needs better addressing in this county. It's been dragging around too long, and there's something needs to get done to show evidence that something's going to happen to improve the broadband here. Third of all, the emergency radio system. That does need addressing badly. I'm therefore requesting the board consider creating an emergency radio advisory board to include experienced members who know radio systems as well as antenna systems. And I have a person who would be very good to head up an advisory board of that nature, ex-CIA radio communications, ex-FBI radio communications, ex-military radio communications, etc. That's all I have for tonight.
All right. Thank you for those 3 items. I've made a note, and I'll follow up with you on those in the days ahead. All right, Commissioner London.
I don't have anything to add.
All right, very good. Well, thank you for that. All right, that concludes this section with no further comments. Is there a motion to adjourn tonight?
So moved.
So moved by Commissioner Pierce and second by Commissioner Bunn. I don't think we need a roll call vote on that. Thank you for being here tonight and for your efforts and time. And I look forward to working with each of you in this new year again. As I've said before, we have a great opportunity in front of us and some good things to do. And I'm looking forward to rolling my sleeves up and working alongside of each of you to make some great things happen. So thank you again. Good night to everybody. And thank you again, County Manager, for all your efforts this coming year.
Happy New Year.
All right.
Happy New Year.
Happy New Year. Good night, everybody.